With a robust team of multifaceted healthcare experts serving all 50 states, Health Management Associates is a full-service national research and consulting firm specializing in publicly funded healthcare and human services. At HMA, it is our people who make the difference. Our colleagues have the know-how and experience to guide clients through the ever-changing healthcare landscape. From skilled analysis to program development, financing to evaluation, HMA has some of the brightest minds in healthcare ready to work for you.
There's a lot of areas that we're honed in on. There's a couple of big ones that really ring out. One of the biggest is changes coming to member experience surveys via things like CAHPS, particularly as it evolves into Medicare Advantage and then also starts crossing into the Medicaid space. So, CMS is in the middle of changing the weighting of their quality scores for member experience from what used to be 1.5 weighted, which is now double weighted, and is moving into a 4 times weighting system, which is going to cause some pretty significant disruptions in the Medicare Advantage space. The thing that we've seen happen then is those same groups in the Medicare side, many states are paying attention to this. So they are now applying very similar principles into the Medicaid area. So increasingly, we're seeing things like member experience, CAHPS, and member reported outcomes really starting to cross into Medicaid for a lot of states that are trying to evolve their quality programs in a more robust way. That also includes seeing things like member experience scores for the first time really being heavily weighted in things like RFPs for procurement in the Medicaid space. So, when we think about the quality spectrum, these areas around member experience, CAHPS, and sort of what we consider to be the areas of quality that have mostly been sort of left to the side a little bit are really starting to be reinvigorated in a bigger way. You think of it like for the last sort of 15 years or so, the quality system has been relatively easy to sort of leave CAHPS alone, right? The points, the way they broke down in Medicare Stars, many value-based reimbursement programs on the Medicaid side were very intrinsically linked towards things like HEDIS scores and regulatory outcomes, performance standards along those lines, pharmacy. So most plans sort of invested 80% of their time in that space, with a very small 10 to 15% being invested in member experience. So what you're starting to see and what we're seeing emerge as best practices is sort of this like shifting of the model, right? So you can no longer invest 80% of your energy on the clinical and regulatory side and expect that CAHPS is going to be fine and that you can use the other scores to carry you across the finish line, whether it be for Medicaid bids or for your Medicare side. So we're seeing this bigger reliance on developing in-house data-driven models around CAHPS. So think of it like CAHPS is a once-a-year survey that you get one quick insight into member experience. So how do you develop a real-time data capture system on member experience? So thinking of things like, can you use your encounter system to trigger surveys out to your members in real time that you can then start actually getting real program evaluation analytics on member experience into your organization. So partnerships like that between payers, providers, and even states starting to get more involved in looking at lenses about what are you doing to capture this kind of data and information, I would say is sort of this big evolutionary process that's really starting to take hold right now. Plans that are figuring this out or really putting some teeth into it are the ones that are really setting themselves up for success in this space and starting to get ahead of the curve when it comes to things like, quality bonus payments, growing market share, items like that as it pertains to the quality space. It's very easy to compartmentalize quality, to think of it as there's accreditation, from URAC, NCQA, AAAHC, Joint Commission, right? Many regulators out there. It's also very easy to compartmentalize things like HEDIS and pharmacy initiatives or compartmentalize member experience. What we have found as one of the keys to success in clients and groups that we've worked with is when organizations can really align those things. So think of it from the perspective of taking one measure, right? So it's not just about doing something like helping one member with their diabetic A1C. It's about, does the regulatory framework and how you view your policies, your processes, line up all those interventions work within that regulatory space, right? Can you use those interventions to show proof of your NCQA accreditation requirements, your URAC requirements? Can you then layer on those clinical interventions? Are you measuring the experience of care that that member had when they went to get their diabetic A1C? And more importantly, are you compartmentalizing that all in a framework that then leads to higher performance outcomes, whether it be through STARS revenue, Medicaid-based performance dollars, or any other demonstration programs or projects? So what we find happens when things get misaligned is one of those frames start to lose focus, right? So I think one of the things that I would really just stress is it takes a village to make quality work, and it's really easy because of the complexity for one of those pieces to be unaligned. So those three pillars are really core to understanding the quality landscape. And that's a lot of what we've done in the past here, is really understanding those lenses and helping diagnose sort of where is the biggest opportunity. Oftentimes plans think that something like focusing on an A1C score is going to be what carries them across the finish line, when in reality it has nothing to do with A1C. It's more about the experience of care or the way the regulatory processes are currently working for your system. So, I think that that's something I would kind of keep in mind with organizations, is start looking at the full lens of quality programs and how you can really align yourself for success in those areas.